coming in. They, I guess, would say, well, it's now self-evident that those 878,000 people may have been trying it on.
Well, it's a rather more complicated story than that, of course. So we know that people quite often don't go through the test because they find a job. We know that quite a lot of people don't go through the test because they're terrified of this test. And we also know that quite a lot of people appeal against the decision, with very significant numbers then having their appeal upheld.
And those figures haven't been released in this latest government statement?
Well, there's data buried in the tables around the appeal level, which is still at around about a third of people who are appealing are having that appeal upheld. Right. So we still have a very significant number of people who are going into this process, often people with mental health problems, who are feeling that the test isn't fair to them.
What is the process? What is the test then?
So this is a test which is run by Atos on behalf of the Department for Work and Pensions.
What is Atos?
It's a private sector company. Right. They undertake tests with medical specialists, and people have to be medically trained. But what we hear still is that people are not necessarily sufficiently expert in the issues that somebody who is disabled might be coming along with.
Because see, the government press release I saw last night mentioned doctors, that doctors saw these people. That's not necessarily the case then.
Well, they're medically trained people. They often are doctors, and they're sometimes nurses. They're a kind of wide range of medical professionals. I think our concern is about the quality of the training they receive, and because you might be a good doctor, but it doesn't necessarily mean you're a good assessor for somebody's fitness to work. And, you know, we know that this isn't easy, but we do think that this test could be better and more accurate.
And is that rather more difficult for them to assess when we're talking about some kind of mental incapacity or difficulty rather than something that is self-evident, a physical disability?
Well, I think we at Mind certainly feel that people with mental health problems have told us in very large numbers about their concerns about their process through this test. So certainly we believe that the skills that are needed, you need specialist assessors to really get this right. But I think there is a broader issue. Many disabled people are also telling us that they feel that this process doesn't feel fair.
Yeah, and when we talk about mental incapacity, I mean, that can actually just be depression. I say just depression, but obviously when you go to perhaps one of these tribunals and say, I'm depressed, I can't work, then you're going to have a very difficult argument persuading them, one assumes.
Well, the key here is to make sure that the assessors have as much medical information as possible, and in the process we would like to see more medical information available from doctors so that you can see somebody's mental health history. Is
there, however, on the other side of the debate, this element that perhaps people are getting into work successfully as a result of this process, and it may actually be benefiting those people in that way?
Well, we know that many people with mental health problems really do want to work. They want to find work, they want to get the right kind of help and support to find themselves back in the workplace. And if you can get this system right, then there is a willing workforce ready to contribute to the UK economy. I think, however, so far we've seen very little evidence that the current programmes, the work programme and this test, is really making a significant difference for this group of people. And we'd really like to see the government reconsidering its whole approach to disability and employment so that we can find a much better system to really address the needs of disabled people.
And do you believe they are prepared to listen to you?
Well, we've had quite a lot of discussion and debate so far. I think the government is beginning to recognise that so far this system isn't really working for disabled people, and we'd like to encourage them to really have a much more thorough look at this.
Because there's a double whammy, isn't it, in that disability living allowance, which was to help people get into work, has also been removed.
And tomorrow, 1st of April, is a massive day for many people with mental health problems and disabled people more broadly. You've got a whole swathe of changes in the welfare state. This is a state that people really often rely on. So not both in terms of benefits changes, but also big changes in the NHS, cuts to legal aid. Really big day tomorrow, and we really think it's crucially important that this isn't about hundreds of thousands of people. This is about individuals whose lives are being affected at the moment, and we really hope that they get the help and support they need to be able to live the life that they really want to live.
And they can contact Mind if they are concerned?
Absolutely. Support available from many charities, including Mind, 24 hours a day.
Paul, thanks very much indeed.